My name is Heather Savage, and I'm a physical therapist, and I have specifically do physical therapy and pelvic health rehab. I work with a lot of women postmenopausal who are now having leaking issues, and they're confined to their home. They're really feeling socially inadequate or maybe isolated because they're having bladder issues, and that happens a lot after menopause and hormonal changes.
My name is Dr. Elizabeth Watt, and I am a clinical psychologist and a certified sex therapist. And pelvic floor therapy is one of the most common referrals I give my clients, especially those who are coming to me to talk about experiencing sexual pain.
Majority come because they are in a sexual relationship and they're finding that penetrative intercourse is actually painful. Or maybe they have started to have flashbacks and realize that there was some molestation or abuse that happened when they were a child. And maybe it was triggered by this relationship that they're having. So those are probably the higher percentage of patients I see because they want to be able to engage in intercourse and not have pain. So that's a lot of my clientele actually is things like vaginismus or dyspareunia, big terms, but that's what that means is pain with intercourse or penetration in the vagina. A lot of times I get people who come to me with hip pain or back pain, and we come to find out that it's actually related to the pelvic floor. And so they could be seeing general therapists for a long time, many doctors. It may take them a long time to find us before we realize that the source of the pain is coming from internally the pelvic floor.
My own experience with pelvic floor physical therapy, pelvic health physical therapy, started in 2003. I was having physical therapy for, chronic pain. I had been diagnosed with fibromyalgia. I told my physical therapist I thought I should wait to do more until I had more psychotherapy because I thought that was the cause of Kegels being so painful for me. When she heard that, she said pelvic floor physical therapy is what I needed.
There's also issues, post-trauma, sexual abuse, maybe even just physical abuse. The muscles, like our neck muscles, can guard and tense. Our nervous system can become sort of in this fight-flight response, and that can happen just any type of trauma we can guard. And so what happens then is we develop sort of a dysfunction where the muscles won't relax and release, and then we can't urinate like we want to. Maybe we have a hard time eliminating bowels. Maybe it develops abdominal pain. It can turn into all kinds of other internal organ dysfunction because those muscles are so tight, it's basically squeezing them. Okay, we can also get nerve pain from the nerves that enter through the sacral nerve roots and things that enter into the pelvis, and so then that can cause leg or thigh pain, abdominal pain as well.
When I was able to no longer have that scarring, then I was able to move my body more correctly in walking. I could have correct posture with walking, and a lot of my pain went away around that time. I never would have been able to get as well as I am now without that treatment.
We also work with people who maybe have lower abdominal pain, a lot of menstrual cramping. That can be related to fascial tension and tightness in the abdomen, as well as maybe some visceral adhesions. So somebody with endometriosis or polycystic ovarian syndrome, and maybe those people want to get pregnant and they're having fertility issues. So we can actually dive into that region as well.
This past year, I was pregnant and gave birth to my first child. During pregnancy, specifically towards the end of my second trimester, beginning of my third trimester, I started experiencing what I now know are really common symptoms or sensations during pregnancy. Specifically for me, I was experiencing a lot of pain in my hips, and I was experiencing some pain during sexual intercourse or sexual touch. And so, because pelvic floor therapy has been, for me as a sex therapist, a really common referral I've given, I decided I was going to go see a pelvic floor therapist because I had never had my own appointment. And my experience was overwhelmingly positive.
Pre and postpartum, there's a lot of trauma that happens to that pelvic floor, scarring, tearing.
During the course of pregnancy, especially as you're getting heavier and everything internally is moving and adjusting, that this can, in some people, create a lot of pressure and tension that comes out as pain during contact. So even just that was really helpful for me to have that explained. So I knew what was going on, I knew why. But then additionally, in following follow-up appointments, I was given and shown different exercises that I could do and that I could have my partner help me with, specifically related to massage, both external and internal massage, to help kind of keep the tissue loose and help decrease the pain. And it really helped. Another thing that I learned in my pelvic floor therapy during that time leading up to giving birth was the proper way to push. So during my assessment, and when the therapist was helping me do these exercises, she assessed for the strength of my pelvic floor muscles. She assessed for areas where there was tension, and she actually guided me through different ways to bring my awareness down to my pelvic floor muscles. And she helped instruct me how to hold tension and then how to relax, just like I would need to during a contraction and ultimately during the pushing stage of delivery. I realized very quickly, what I thought would have been proper pushing would not have been. I would have had a much harder time during my delivery if she hadn't taught me this kind of proper way to push. After giving birth, I then went in for a follow-up. Again, she was able to assess where my strength was in my pelvic floor muscles. I had a little bit of tearing during delivery, so she was able to explain to me exactly where that tearing was and what the scar tissue was doing. And again, exercises and ways to help break down some of that scar tissue. So not only that I wouldn't have any pain, but that I would heal more effectively. And I'm so grateful for that.
Being able to walk through that journey with them became more of a passion than a job.